Hey, so welcome back to Ask Dr. McCord, and our question is, what about spinal imbalances and what can you do about those? Stay tuned for this information on Ask Dr. McCord. Hey, welcome back everyone. Thanks for joining us again on our next episode here of Ask Dr. McCord. Really just wanted to thank you for, I'm sure this is probably not your first maybe it's multiple episodes that you've watched as we're trying to educate our community here about health, living healthier into your 80s, 90s, and 100s with our 100-year lifestyle approach, and also how chiropractic actually fits into that. And today I want to address with you what we call heel lifts. And let me talk just briefly about, kind of set a perspective about why heel lifts could be important, and some of you may or may not be familiar with heel lifts. This is a plastic model of the spine, and from the back or the front view, the spine should be balanced. You should have your hips balanced, your shoulders balanced, and your head balanced, with the center of your head, your occiput here we call it, over the center of the sacrum, which is the lower part of the bone. And what can happen is, due to deficiencies of leg length, either because of a broken leg, maybe a knee injury, a hip injury, could have been just how your leg actually developed when you were developing as a little boy or girl, or it could be because of a faulted arch in your foot. What can happen is one leg can become shorter than the other. And what that does is, if you can see here on the model, if the left leg here is actually shorter, it's going to tilt the spine, and it's going to cause a extensive amount of instability here in the lower back. And then what happens is it can affect the whole spine all the way up to the top of the head. So when we find that a patient would have a deficiency of leg length, what we do to support that, and it makes a tremendous impact and stability with our care, is we recommend a shoe inserted heel lift, which is basically a sliver of rubber. This was a lady small, and that's a 5mm size. They go from 3 all the way up to a thickness of 12, and sometimes we're actually able to double those as well to help with correcting that deficiency. And what it does very simply is, it just is an inserted piece of rubber that goes inside the shoe, and you stand on that, raising your heel up, that 3 to 12 millimeters, making a difference in the hip stability, which can make a difference in your whole spine. And so one of the things we really try to do is, balance is a key, and the more we can balance the spine, the healthier your nerve system, the healthier you're going to be. So I hope that answers some questions, and we do a lot of this in the office. We do a number of measurements and calculations to actually find out whether or not you're a candidate for this. But this is one of the things I've seen actually in my practice, where patients have come into me that have seen other chiropractors, other healthcare professionals, struggling with getting some level of stability and pain relief and issues that can be existing. We simply put a heel lift in, and it makes a miraculous difference. So you actually may be a candidate for this, and we want to help you get that part of your health figured out, and we can certainly do that. If you're enjoying these messages, we want to recommend that you go on our website and click on more of the Ask Dr. McCord's episodes as well. And you can also subscribe to our YouTube channel at Ask Dr. McCord. So once again, thanks for joining us, and hope that these kinds of things help you. And remember, we want to help you to live longer and healthier and stay healthy for a lifetime. Signing off, Dr. Allan McCord, Kent East Chiropractic.